Hi everyone, welcome back to my YouTube channel. Today we are going to talk about periodontitis. And here at the side you can see the diagrammatic representation of normal tooth, gingivitis, mild to moderate periodontitis and advanced periodontitis for reference. So let's start our topic with introduction. Periodontitis is a serious gum infection that damages the soft tissue and destroys the bones supporting the teeth. It is a common dental disease but is largely preventable. If untreated, periodontitis can lead to tooth loss and is linked to various systemic conditions, including heart disease and diabetes. Definition: periodontitis is defined as chronic inflammatory disease affecting the periodontium, that is, the tissue that surrounds and supports the teeth. It includes gingiva, periodontal ligament, cementum, and alveolar bone. It is caused by a specific bacterial infection that trigger an immune response leading to tissue destruction. Anatomy of periodontium. Periodontium consists of four key components. First is gingiva, that is the soft tissue component that surrounds the tooth. Second component is periodontal ligament, that is connective tissue fiber that attach the tooth to the surrounding bone. Third component is cementum, that is a calcified layer covering the root of the tooth. Fourth component is alveolar bone, that is the bone that houses the tooth socket. These structures work together to maintain tooth stability and function. Causes of periodontitis. First cause include bacterial plaque. That is the primary cause. When plaque accumulates and is not removed, it hardens into tartar and harbors harmful bacteria. Second cause is poor oral hygiene. That is failing to brush and floss regularly allow plaque buildup and that can lead to periodontitis. Third cause may be smoking and tobacco use that significantly increase risk and severity of periodontitis. Fourth cause is genetic factor as some individuals are genetically predisposed to gum diseases. Further, next cause may be systemic diseases, that is conditions like diabetes and HIV that affect immune system and increase susceptibility for periodontitis. Next cause may be hormonal changes like in pregnancy, menstruation or menopause that can make gums more sensitive. Sixth cause may be stress and poor nutrition that weakens the body's ability to fight infection. Now let's talk about pathogenesis of periodontitis. This disease begins as gingivitis, that is a mild and irreversible inflammation of gums, as you can see here in the diagram, the second picture. If not treated, gingivitis can progress to periodontitis. This bacteria in dental plaque release toxins that stimulate an immune response. The body's own defense mechanism begin to destroy the periodontal ligament and alveolar bone. This results in formation of periodontal pocket, gum recession, and tooth mobility, and eventually it can cause tooth loss, as you can see here in advanced stages of periodontitis. Types of periodontitis. It includes chronic periodontitis, aggressive periodontitis, periodontitis as manifestation of systemic diseases, and necrotizing periodontal disease. Now let's talk about these types one by one. First is chronic periodontitis. This is the most common form of periodontitis, typically affecting adults. Its progression slowly and is characterized by gum inflammation, pocket formation, and gradual bone loss. Second type of periodontitis is aggressive periodontitis. It occurs in otherwise healthy individuals and is more rapid in onset. It often affects younger individuals and has a strong genetic component. Third type is periodontitis as a manifestation of systemic diseases. This form is associated with diseases such as diabetes, blood disorders, and immune deficiencies. It requires multidisciplinary management. Now let's talk about signs and symptoms of periodontitis. First, there may be red, swollen, or bleeding gums. Second, there may be persistent bad breath or bad taste. Third, there may be gum recession or pulling away from the teeth. Fourth, there may be formation of deep pockets between teeth and gums. Fifth, there may be loose or shifting teeth. Sixth, there may be pain when chewing. Seventh, there may be changes in the way teeth fit together when biting. Diagnosis of periodontitis. Diagnosis involves both clinical and radiographic examination. First we do is visual inspection, that is checking for gum inflammation and recession. Second we can do is probing depth measurement. That is using a periodontal probe to measure pocket depth around each tooth. Third we can do is bleeding on probing. That indicates inflammation. Fourth we can do is dental x-rays to evaluate bone loss. And fifth we can do is patient history, that is assessing risk factors like smoking, family history and systemic diseases. Treatment of periodontitis. The goal of treatment is to control the infection and stop disease progression. It can be done by non-surgical treatment and surgical treatment. Then there is another thing associated with periodontitis, that is maintenance. First, we will talk about non-surgical treatment for periodontitis. It includes scaling and root planing, that is deep cleaning to remove plaque and tartar below the gum line. It also includes antibiotics that may be local or systemic antibiotics that may be used to reduce bacterial load. Second type of treatment for periodontitis is surgical treatment. It includes flap surgery, that is lifting the gums to clean deep pockets and then repositioning them. Second, we can also do bone and tissue graft, that is regenerative procedure to restore lost bone and tissue. Third, we can also do is gingivectomy, that is removal of excess gum tissue in certain cases. Next part of treatment of periodontitis includes maintenance, that is done by regular follow-up visits, professional cleaning every 3 to 6 months, and strict oral hygiene at home. Complications: if periodontitis is not treated, it can lead to tooth loss, abscess formation. It can also lead to gum recession and root exposure, and there is increased risk of systemic conditions such as cardiovascular disease, stroke, diabetes complication, respiratory infection, and adverse pregnancy outcomes. Prevention of periodontitis: brushing teeth at least twice daily with fluoride toothpaste. Second, we can prevent it by daily flossing to remove interdental plaque. Third, we can do routine dental checkups and professional cleaning. Fourth, we can also avoid tobacco use. Fifth, by maintaining underlying health condition, we can prevent periodontitis. And sixth, by eating balanced diet to support immune health. Now let's talk about conclusion of this lecture video. Periodontitis is progressive but preventable oral disease that significantly affects dental health and quality of life. With proper oral hygiene, regular dental care, and early intervention, the onset and progression of periodontitis can be effectively controlled. Understanding its cause, clinical features, and management is essential for promoting lifelong oral and general health. And this was all about periodontitis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.